My name is Matula. I have 10 years in public health and safety, and today I'm going to talk about vaccinations and more specifically herd immunity. So it's flu season right now. Nobody wants the flu. It's a bad disease. You get sick. A lot of people die from it every year. But you hear a lot of people say that even though I've gotten vaccinated, they still get sick. And a lot of people contribute that to vaccinations don't work, or vaccinations cause you to get sick, but that's not actually the case. So with all vaccinations, you have to have a certain percentage of the population vaccinated for it to be effective. And that's the concept of herd immunity. Now, this varies from different types of diseases. Bacterial and viral are different, but there's a certain percentage for most diseases that scientists know that if a percentage of the population is vaccinated, then most everyone will not get sick and the number of outbreaks will be reduced greatly. But there is still a chance of people getting sick even if most of the population is vaccinated, but it's limited when you reach that critical mass of people. So the difference between viral and bacterial is that bacterial infections can be dormant in people and not necessarily cause them to be sick, versus viruses that typically you have symptoms when you have it. A really good example of that is smallpox, and that's also a great example of herd immunity working. So smallpox was an epidemic, killing lots of people, and the entire world, for one of the few times, actually got together and followed the World Health Organization's directives and vaccinated all these people with smallpox. So when it reached that critical number, the disease started to die out. People kept getting vaccinated, and then now smallpox doesn't exist. There hasn't been a case since 1977. So it only exists in a laboratory for studies and scientific purposes. So then you have bacteria, on the other hand, like I said, which you can be infected with and not necessarily be sick. So an example of that is meningitis, or other diseases that communicable stuff like pertussis, and that's a good example of herd immunity. When it stops working, what can happen with the disease? So pertussis was a very deadly disease in the U.S. and worldwide, and overall, when the vaccine first got introduced, 284,000 deaths have been attributed to it. So in the 1930s, when the vaccine was not really available in the U.S., that's when the peak total of deaths occurred. So there was approximately 265,000 cases and 7,500 deaths in the 1930s from pertussis, which is whooping cough. Then in the 1970s, when the vaccine was introduced, reached herd immunity status and started dropping, the cases fell to about 1,010 in 1976. And then only 4 deaths occurred. So since then, people assume that because no one is sick, that there's no longer a need for the vaccine. But pertussis is bacterial, and so adults can carry it, but the most susceptible people are children. So adults don't get their boosters, to keep the vaccine up to date, and so the disease has surged back. So in 2007, there were 10,000 cases, and there's small pockets across the nation where, like California and Colorado, where there's communities that feel that vaccinations are ineffective or that they give you disease. A lot of those reasons that people say that vaccines aren't useful. And in those populations, an example of pertussis, children with parents that don't believe in vaccinations had an instance of 11.5% infection rate, and people whose parents did get them vaccinated had a 0.5% chance. So it's a 22.8 times greater likelihood that you're going to have the disease, which can be fatal if you're not vaccinated versus vaccinated. So, and that's the whole concept is, even though everyone around you, might be unvaccinated and you think you're safe, vaccines aren't 100% effective. Say, if you get a vaccine for trust us, you might be 90% resistant to the disease. So if you get exposed to one person with it, then you might not get sick. But if 10 people around you are carrying it and you keep getting exposed to it, then the likelihood is you're going to get sick even though you've been vaccinated. So that's where the herd immunity comes into effect. And if 90% of those people, so 9 out of the 10 have it, the one person might get sick, but that's only one infection trying to, infect someone that's 90%, immune to it. And so those people are most likely not going to be sick. So that's how herd immunity works. It's very important to get vaccinated. You can speak to your doctor about it, and I'm sure they can inform you anything else. But I hope that gave you good information on the concept and why everyone in your household should probably